You are now entering Module 2 so that you may obtain credit for the current and future modules of the EMS Officer 1 online program. You must complete the module and submit your online certificates to the course instructor. In this chapter, we will look at the EMS officer and his or her role in leading the EMS team. The team may be a two-person crew or could be several crews. The objectives for this chapter include: describe leadership in routine situations, describe the leadership challenges related to the EMS station work environment, and describe the leadership challenges related to the volunteer EMS agencies. Leadership professor Gary Ewald defines leadership as the process by which a person influences others to understand and agree about what needs to be done and how to do it, and the process of facilitating individual and collective efforts to accomplish a shared objective. A person carries out this process by applying his or her leadership characteristics, and your position as an EMS officer gives you the authority to accomplish certain tasks and objectives in the agency. This power does not make you a leader, it simply makes you the supervisor. Your leadership attributes are based on your beliefs, your values, ethics, character, knowledge, and skills. These attributes are developed and established with time and experience. The position of EMS officer confers authority, but does not make a person a leader. Bosses tell people to accomplish a task. Leaders make people want to achieve goals and objectives. These leadership skills are acquired over time and with experience. At times, as an officer, you will make mistakes. This is part of the learning process to become a leader. Making mistakes will happen. Learning from them will make you a good leader. The EMS officer as a follower. Leaders can be effective only to the extent that others are willing to accept their leadership. An EMS officer has to be both a leader and a follower. As a follower, you learn and gain experiences that will help guide you as you become a leader. Let's take a moment to look at various leadership styles. The autocratic has an iron hand approach. It's used when an EMS officer needs to maintain high personal control of the group. An example would be at the scene of a major crash or an MCI. Another approach better suited for situations that do not need immediate action to take place is the democratic. This is a consultative type approach that is used when planning a project or developing a daily work plan. Specialized EMS agencies often use this approach when faced with an unusual emergency situation. Execution of the plan often involves an autocratic command style. Sometimes this is seen when several personnel get together to decide how to respond to a situation such as a cardiac arrest. Once a decision is made, the plan may be carried out using a more autocratic approach. Another style is the laissez-faire, more or less a free-rein style. It is effective when working with experienced EMS providers handling routine duties. This leadership style moves the decision-making from the EMS officer to the individual EMS provider. The EMS officer depends on the provider's good judgment and sense of responsibility to get things done within basic guidelines. This approach is an effective leadership style when working with experienced EMS providers and when handling routine duties that pose little personal hazard. Conversely, this approach is not effective with new or inexperienced providers or during hazardous situations. Next, we will discuss power and its effect on leadership. Power is the capacity of one party to influence another party. One of the first works on the management of power was The Prince, Niccolo Machiavelli's masterpiece, posthumously published in 1532. In their 1959 Studies of Social Power, French and Raven described types of power as the result of the target person's response from the agent making a request. Legitimate power is the target person believes that the agent has the right to make the request and the target person had the obligation to comply. For example, under the incident management system, the incident commander has the legitimate power to reassign the triage group. There's reward power, where the target person complies to obtain rewards believed to be controlled by the agent. There's expert power, where the target person complies due to a belief that the agent has special knowledge. There's referent power, where the target complies due to admiration of or identification with the agent and seeks approval. And there's coercive power. The target person complies to avoid punishment believed to be controlled by this agent. Professor Gary A. Ewald from the University of Albany divided French and Raven's types into two categories: personal power, which includes expert and referent power, reflects the effectiveness of the individual. And then there's positional power. In contract, is defined by the role an individual has within the organization. Legitimate, reward, and coercive power are the three examples of positional power. Ewald added two more position power descriptions: the information power, which is control over information. Unlike expert power, information power is based on the target person's assessment of the agent's ability to discover or obtain relevant information rapidly and effectively, usually through a cultivated network of resources. Ecological power, control over the physical environment, technology, or organization of work. The target person's behavior is based on perceptions of opportunities and constraints. Most EMS officer leadership activities are directed toward routine situations. This includes being well prepared to perform in emergency situations. The EMS officer accomplishes most of these goals and objectives through the efforts of crew or team members. The role of the officer involves influencing, operating, and improving to ensure that these efforts achieve the desired results. Unlike many years ago, today's workforce is much different. Today's employees demand to be included in the decision-making process. As a result, effective EMS officers use a participative form of leadership. The officer must have discretion regarding when, how, and by whom assignments are carried out. Some officers sit down with their crews at the start of the shift and cover the assignments. Others have meetings in the middle of the shift or towards the end of the shift to accomplish the same thing. A core responsibility of the EMS officer is to handle emergencies effectively. The EMS officer has direct leadership responsibility for his or her crew. The first arriving EMS officer of an incident may have additional important responsibilities to establish command and to provide direction to the rest of the responding units to that scene. The first arriving EMS officer also has leadership responsibilities that relate to the communication center. This includes giving a situation report and requesting additional resources. The EMS officer's primary responsibility is to the providers under his or her command and is responsible for their safety, their directions, and performance at the scene of an incident. The EMS officer should develop a consistent approach to emergency activities in which all of the department's operating procedures are followed. A pre-assignment. This allows the EMS officer to make fewer decisions during an emergency. For example, the driver of the ambulance will be responsible for establishing and maintaining an airway and then take vital signs. Assigning on the scene, however, reduces unnecessary efforts. Often the EMS officer uses a more autocratic style of leadership because the emergency scene does not allow for participative decision making. Dangerous situations can develop suddenly during incident operations. An autocratic leadership style is necessary when immediate action is required. The EMS officer may directly encounter a dangerous situation, such as a person with a gun or a careening vehicle. In such a case, you must make an immediate, clear, and autocratic command to protect the provider under your supervision by removing them from the danger area. Then you need to provide a CAN report giving the conditions, actions taken thus far, and need for additional resources. After every incident, the EMS officer should review the event while still at the scene or as soon as possible after returning to quarters. In many cases, ambulance crews will review calls at the hospital. This is an opportunity to clarify issues and answer questions. The EMS officer can reinforce good practices and immediately identify any unacceptable performance. The first arriving EMS officer at an incident describes the conditions and situation to dispatch. The content of this report must comply with departmental operating procedures or guidelines. This verbal picture establishes the tone for the incident so that others know what to expect upon arrival. The initial on-scene radio report is made up of the following elements: identification of the arriving unit, confirmation of proper location or updates of location if needed, a brief description of the incident or the current situation, brief description of action that is being taken or needs to be taken, declaration of the strategy to be followed, any obvious safety concerns, command identification and location as appropriate, and request additional or to release surplus resources. The first arriving EMS officer provides leadership and direction to responding units. The EMS officer must demonstrate the ability to take control of the situation and provide specific direction to arriving units, as well as allowing those units that are operating to carry out their specific tasks. To do so requires mastery of the autocratic style of leadership. The EMS officer works in a dynamic environment with challenging conditions and evolving organizational needs. The basic leadership concepts prevail when considering two unique challenges an EMS officer faces. The EMS station as a workstation or location. Most of the challenges faced by an officer are not at the scene of an emergency. Most of their skills are challenged dealing with personnel at the station. This is dealing with normal day-to-day activities and behaviors that occur in any work location. Leading a volunteer EMS agency. Leading an EMS agency may be a challenge. However, leading a volunteer agency has its own unique challenges. While volunteer members may not be receiving compensation for their work, their expectations and their role is the same. When a patient is in need of care, it does not matter if the provider is getting paid or not. The expectation is that the patient will receive the best possible care. In many areas, EMS providers work rotating shifts regularly and may even prepare and share meals together. There are days of dull routine, punctuated by episodes of intense excitement. These factors create a powerful and special community among EMS providers that is difficult to compare with other workplace environments. Providers think of their station as a home away from home. This workplace environment produces a special kind of bonding among workers, but it can produce productivity problems as well as behavioral and personality traits that are often quite challenging to deal with. Many situations can be quite different from the problems that occur in a normal work environment, and the behavioral issues are often more severe. The EMS officer must maintain order at all times. An EMS officer must balance the expectations of the employer with the realities of an EMS station work environment and the desire to create an effective team. A certain amount of spirited behavior can be healthy as long as basic rules are observed. The EMS officer has to maintain order and ensure that whatever occurs can be explained and would be acceptable to a rational observer. Two general rules for non-emergency activities. Do not compromise the EMS agency's ability to respond to emergencies, and do not jeopardize the public's trust in that EMS agency. Responding to emergencies and preserving the public trust are two values that every EMS provider needs to demonstrate. And within those values, there is a wide latitude for team building and extracurricular activities. EMS officers leading volunteer EMS agencies have to rely on their leadership skills even more than their municipal counterparts do. The EMS officer must promote the satisfaction of every member and be alert for issues that could create a conflict. There are 4 phases of volunteer participation. There is a large loss of applicants during training. The candidates could not make the time commitment, were physically unprepared, or could not pass the cognitive certification exam. There's a small loss during the probationary period. During the first year after joining an agency, members are typically consistent participants in emergency and administrative duties. There is a moderate to high loss between the 3rd and 6th year of membership. Younger members are finishing college, getting married, having children, and building their careers. The ones who do not leave cannot devote as much time to the volunteer service as they once did. And then there's the 4th, which is a commitment or recommitment between the 15th and 18th year of membership. And those volunteer EMS providers who never left significantly increase their time with the agency, and many who left start returning. The children are grown, the career is established. This group forms the core of the volunteer EMS agency. Power does not make you a leader, it makes you a supervisor. As a supervisor, you are accountable for the actions of those you supervise. Effective leaders are good followers. In order to be a good leader, you need to have followed others who have been successful. 3 situational leadership styles are typically used: the autocratic, the democratic, and laissez-faire. Knowing when to use them and how to use them effectively will make you a good EMS officer. Types of power may be categorized using several different methods. Most EMS officer leadership activities is directed toward routine objectives. A core responsibility of an EMS officer is to handle emergencies effectively. An EMS officer must use the autocratic leadership style when immediate action is required. The first arriving unit needs to describe current conditions to dispatch. That information is provided initially to help set the tone for the incident. The EMS agency environment can produce productivity problems. Learning how to recognize and deal with them will make you a more successful officer. An EMS officer must balance the expectations of the employer with the realities of an EMS station work environment. Pride, group identity, and personal commitment are factors that help to keep volunteers active and loyal to your agency. Chapter 8 is Training and Coaching, and in this chapter we will look at the role that EMS officers play in training and coaching those they supervise. After studying this chapter, you will be able to do the following: discuss the role of training in the EMS service, discuss the EMS officer's role in training EMS providers, and describe the 4-step method of instruction. You will be able to describe on-the-job training and the order in which skills must be taught, as well as describe how to develop a specific training program. Training and coaching are core EMS officer tasks. Currently, there are no national EMS instructor qualifications. and it is generally left to the respective state to set the requirements, unlike the fire service, which has the NFPA 1041 standards for fire service instructor professional qualifications, which describes the requirements for 3 levels of an instructor. Training ensures that every provider can perform competently and every EMS provider is prepared to operate as a team member. When training, you must take into account all aspects. These include anticipating high-risk situations, urgent timeframes, and difficult circumstances. Train as you work and work as you train is an often used motto to ensure responders remain safety conscious and competent in their skills. As a responder, 2 of the most important skills you need to develop are situational awareness and critical thinking. Situational awareness is needed to anticipate any safety issues or concerns for those operating on a scene. This could be anything from personal safety, hazards on the scene, or how long you've been working a cardiac arrest. As an officer, situational awareness is vitally important. Critical thinking means knowing protocols, procedures, and policies are important. However, being able to think of what is the best solution or an approach to a problem requires the ability to use those protocols and policies to make the best possible decision. Many times the answer will not be in black and white, so you need to be able to make a decision. As an EMS officer, others will be looking at you for that direction. Through training, you not only improve your skills and abilities, but you are also responsible to make sure that your personnel are able to do so also. Initial training leads to basic skill certifications such as emergency medical technician and emergency medical responder. These certifications are often required before an EMS provider is authorized to participate in field operations. Most providers work toward achieving higher levels of certification, such as the advanced level EMS courses that are offered in Virginia, advanced EMT, intermediate, and paramedic. A provider may be required to achieve additional qualifications. This may be a range from protocol updates up through technical training. Most agencies will have additional training for a new member to ensure that every EMS member is prepared to operate as a team and perform competently. This should be conducted under the supervision of an EMS officer. Multi-agency drills should also be conducted periodically to ensure the ability to efficiently operate in the event of a multi-agency response. EMS officer training responsibilities. A basic responsibility of every EMS officer is to provide training to those he or she is responsible for. One of the easiest ways to accomplish this is by using the 4-step method. The 4-step method development was originated during World War I. This 4-step method remains the method of choice if a candidate must describe how to develop a work improvement plan or explain a new procedure or device. When developing a written or oral response to such an issue, the candidate should identify each of the 4 steps in the training process. These 4 steps are preparation, presentation, application, and evaluation. Let's discuss these 4 steps in more detail. Step 1 is preparation. The EMS officer conducts training to maintain proficiency of core competencies among their team. Sometimes the EMS officer may determine what training is required, while other times it may be at an agency, medical director, or training department level. Some indications that more training is needed are a near-miss incident, such as a failure to properly dispose of a sharp or someone being at risk of a needle stick. An incident scene problem, for instance, not being able to properly use or locate equipment, or an observed performance deficiency, perhaps the inability to place an advanced airway. If necessary, the EMS officer must write a lesson plan. This would then break the topic down into separate units. Furthermore, it would show what to teach, in which order, and exactly which procedures to cover. To ensure that the objective is properly covered, the lesson plan or guide should be used to help accomplish this objective. This is a sample of the lesson plan format currently utilized with the Central Shenandoah EMS Council. There are a number of different formats available, and you should use the one that is the most appropriate or required as necessary. Make sure that your learning environment is conducive to adult learning. Things to keep mindful of would include the ability to view the presentation, comfortable seating, comfortable temperature, and lack of distractions such as phones and radios. This may be a challenge when trying to do classes in a station, so it is important to plan ahead to try to create the best possible learning environment. Step 2 is the presentation. The presentation may be in the form of a lecture, hands-on, or a combination of both. Most often, the EMS officer will be teaching or reviewing some type of skill. The EMS officer demonstrates a skill one step at a time. A common approach is to use the whole, part, whole approach. Whole, first show the whole skill without any interruptions, and part is where you break down the skill and show how each step is done. And then you do it as a whole again, where you repeat the skill without any interruptions. Using this approach allows the student to see how the skill should be performed, then breaks it down so that the student can understand how it should be done, and then is shown again so that the student can see how it is supposed to be performed from start to finish as a form of review. Following a lesson plan allows the EMS officer to stay on topic and ensure that each step is properly covered to ensure that your students are able to fully understand the content of the lessons. Step 3 is the application. The next step of the process, the EMS provider demonstrates the task or skill back to the officer or instructor. The EMS officer should provide immediate feedback, whether positive or corrective, as appropriate. Step 4 is the evaluation or test time. This may be a written or practical examination, and sometimes it may involve both. The EMS officer can be sure training has occurred when there is an observable change in the provider's performance. To ensure proficiency of existing skill sets, some agencies have a standard set of evolutions. The EMS officer must invest some training time practicing these skill sets to ensure their proficiency when performing in the field as well as during an instructional session. Some practice sessions should be performed wearing proper PPE to ensure the ability to perform the required skills while utilizing the PPE as required. Imagine having to perform a technical skill such as establishing an advanced airway on a critical patient while in a mask, gown, and eye shields, and having never practiced establishing an advanced airway wearing proper PPE. Mentoring is a developmental relationship in which a more experienced person or mentor helps a less experienced person, referred to as a protege. The unique organization of EMS, where officers function as working supervisors within a high-hazard environment, makes mentoring easy. In EMS, precepting, training new providers is a form of mentoring. Qualities of an effective mentor or preceptor are a desire to help, a current knowledge of the environment, practices, procedures, and policies, and being able to effectively help develop a candidate through coaching, counseling, facilitating, and networking skills. On occasion, the EMS officer is required to provide the initial training for a new or revised skill set. This is often related to a new device or treatment protocol that has been acquired, such as a new type of cardiac monitor. The EMS providers need to become familiar with the new equipment and proficient in its use. Introducing new or revised skills often requires more time than maintaining proficiency of existing skills. The EMS officer should obtain as much information as possible about the device or procedure, especially identifying any safety issues. Lectures or video presentations should not last more than 10 minutes, since the average student loses focus after 15 to 20 minutes. The lecture or video presentation should be followed with practicing the new skills, and this can be accomplished by encouraging adventure, challenge, and competition. The EMS officer works as a coach when providing training. Much like a sports coach, the officer must take the steps to ensure that the team has competence as well as confidence to effectively complete the skills needed. The first step, team members learn the basic skills. Once these basic skills are learned, then the coach works with them to build confidence and competence. Many EMS provider tasks involve psychomotor skill sets. Psychomotor skill levels can be classified into 4 categories. These levels may be described using the following example of a new driver who is required to know from memory every address in their first due area. During the initial phase, the driver knows the main streets and has a basic understanding of how the street grid and numbering system works. The EMS officer has to help by reading the map when responding in subdivisions and office parks. Next is the plateau phase, where the driver can drive to more than 85% of the streets in the agency's response area without assistance from the officer. At this level, the driver is competent. For the latency phase, the driver can remember the route to an area of first due response where the ambulance has not had a response for several months. And finally, we have the mastery phase, when the driver can easily drive to any address in the first due response area and knows at least 2 or 3 alternative routes to each area they are responding to. The driver knows all of the subdivisions. At this level, the driver is confident in his or her knowledge of the first due response area. To bring EMS providers to the mastery level, the EMS officer must work every day to reinforce skills. Many skills are used infrequently and must be practiced because when the time comes that these skills must be used, they must be able to be performed perfectly. Many agencies require that a new member obtain their EMT and CPR certifications before responding in the field. EMS officers have a special responsibility when operating with inexperienced EMS providers in training. At the very first meeting with the new trainee, the officer should explain the procedures in the station when the team receives a call, assign a senior member to function as a mentor or preceptor, and describe any restrictions that are placed on members while in their training. Federal regulations mandate that 3 topics are covered as part of any emergency service training program. The Occupational Safety and Health Administration, OSHA, has issued Regulation 29 CFR 1910.1030, Occupational Exposure to Bloodborne Pathogens, which requires all EMS personnel to be trained about the agency's exposure control plan, the personal protective equipment used by the provider, and the reporting requirements if an exposure occurs. Hazardous materials awareness. Every public safety member is required to have training at the hazardous materials awareness level. This is OSHA Regulation 29 CFR 1910.20. Hazardous Waste Operations and Emergency Response, or HAZWOPER training, describes these requirements. At the awareness level, first responders are able to recognize a potential hazardous materials emergency, isolate the area, and call for assistance. The National Incident Management System, commonly referred to as NIMS, is a Homeland Security Presidential Directive 5, or HSPD 5, which managing domestic incidents requires incident management training. NIMS provides a consistent framework that operates at all jurisdictional levels, regardless of the cause, size, or complexity of the incident. NIMS creates an all-hazard template for firefighters and EMS responders to operate within a multiple jurisdiction domestic incident within the Federal National Response Plan. The Health Information Portable Privacy Act. Every person that works for an EMS agency that bills for service must receive this HIPAA training. This addresses privacy issues dealing with a patient's personal health information. Failure to follow these regulations can lead to fines and legal actions for both the provider and their agency. As an EMS officer, you may be responsible to make sure that this training has been completed. EMS workers will find themselves in all kinds of situations, many of which can produce a high hazard to their safety. For example, while operating on the scene of a structure fire, EMS providers will be providing a number of potentially hazardous duties. In the rehab area, assessing firefighters for injuries, heat-related emergencies, or chemical exposures. When receiving rescued victims, what injuries can they have or toxic substance on their persons that may present a hazard to the EMS providers helping them. With injured firefighters, we have the extensive PPE and any potentially toxic substances which they may have been exposed to. This goes along directly for Mayday and RIT support. When a Mayday is called, what other actions may be looked over when all attention is being focused on the Mayday? During day-to-day calls, we must always ensure we continue to practice the proper precautions. When operating at the scene of a motor vehicle crash, there is an increased risk of injury due to broken glass, twisted and cut metal, and even passing traffic. During an extrication, providers must remain aware of their surroundings, maintain situational awareness, and prevent tunnel vision. Passing traffic, rescue tools, and responding apparatus can all pose additional hazards, especially when tunnel vision does occur. Oftentimes, ground transport units may request a helicopter for patient transport. When this occurs, what additional precautions must be taken? What procedures must be followed? When a BLS provider is assisting an ALS provider, there is an area of limited or unfamiliarity that can occur. Many BLS providers are not fully aware of advanced practices, including sharps containment, which increases the risk of an exposure or injury. However, if proper training and practice is taken, these risks are greatly reduced. The training action plan will assist in ensuring all the required pieces of the puzzle come together in the end. In doing so, the training action plan will include development of training objectives. What is the purpose of the training? What does the student need to take away from this training when it's completed? Is it a skill or an informational objective? Necessary resources and equipment. Once the training objectives are known, what resources and equipment will it take to complete those objectives? Will you need the entire ambulance or just the cardiac monitor? Will you need the computer and a projector or just some handouts? Proper time and setting. How long does this training need to be properly completed? Is it a 10-minute update or an 8-hour course? Does it require a classroom, or will the ambulance bay be a more appropriate setting? The EMS officer may need to develop a specific training program not covered by the existing certification programs. For example, a work improvement plan or training related to a new device or procedure. Work improvement plans may come annually during annual appraisals. And when new devices are introduced, personnel will need to familiarize themselves with their operations. When developing a specific training program, there are 5 steps which need to be addressed. The EMS officer must first confirm that there is a need for a training program. Some predominant problems may be better solved through an engineering solution. Training has occurred when there is an observable change in behavior. Prior to undertaking the training program, you should identify the specific behavior you want the providers to exhibit after the training. Various methods exist for developing the training program. If training is needed for a new device, the manufacturer or vendor may have a training package available. If training is needed for a new procedure, the agency may have a template the EMS officer can use. Other agencies may have developed training programs, props, or similar resources that they will share. The Virginia Regional EMS Councils are a valuable resource for development and adoption of EMS training programs, which are available to the various agencies in the Commonwealth. Organizations such as EVENT, Firefighter Near Miss, Responder Safety, and other special interest websites may post resources available for downloading. A few minutes of research may provide a rich response. New programs should be subjected to a pilot class or trial run before finalization. This sort of testing provides the opportunity to tweak the program, identify any problems, and correct any unforeseen issues. Although the use of lesson plan is part of the 4-step method, it is important that the EMS officer develop lesson plans for every training program. As you evaluate your training program, ask the following. Have you accomplished the change of behavior that you wanted? Was the training program worth the student or instructor's time? And was the instructional method appropriate for the learning objective? And what can the instructor or developer do to improve the training program? In summary, training and coaching are core EMS officer tasks. EMS training must anticipate high-risk situations, urgent timeframes, and difficult circumstances. An EMS officer must be prepared to conduct training. Remember the 4-step method: preparation, presentation, application, and evaluation. Many skill practice sessions should be performed while wearing full PPE and operating within a realistic situation. Mentoring or precepting, a more experienced person provides a valuable learning environment. Testing new skills will always take more time than maintaining current proficiency of skills. There are 4 psychomotor skill levels: initial, plateau, latency, and mastery. And federal regulations govern emergency services training. Once skills that must be learned are covered, concentrate on those skills that will keep the EMS provider safe. The EMS officer may need to develop and carry out a training program or to ensure that training is completed. Chapter 9, Evaluation and Discipline. In this chapter, we will discuss the purposes of evaluations, the role of documentation and record keeping for evaluations and discipline, and describe methods of positive discipline. The officer conducts regular evaluations of job performance, behavior, and problem resolution. Positive discipline is intended to help the employee recognize problems and make corrections to improve performance or behavior. Negative discipline is intended as punishment for unsatisfactory performance, unacceptable behavior, or failure to respond appropriately to positive discipline. Discipline should be progressive, moving from positive to negative and from minor to major. Some problems are so serious that the earlier steps in progressive discipline might be bypassed in favor of a more severe and appropriate punishment. The EMS officer conducts regular evaluations of personnel and their performance. These evaluations help to ensure each EMS provider knows what is expected of him or her and helps the EMS provider know where he or she stands relative to expectations. The evaluation process helps the EMS provider set personal goals for professional development and performance improvement. It also provides positive motivation to perform at the highest level possible. Many career EMS agencies require a supervisor to conduct an annual performance evaluation for assigned personnel every year. In volunteer departments, the procedure may be less structured. However, all personnel deserve evaluations of their performance. The EMS officer has a special responsibility when starting an evaluation process with a new provider because the officer is actually helping to shape that individual's career. It is the EMS officer's responsibility to determine each individual's skills, knowledge, aptitude, strengths, and weaknesses, and then set appropriate expectations. The probationary EMS provider is expected to obtain certain experiences and demonstrate competencies through a field training or precepting program. This performance evaluations should be a continual process. Feedback on individual performance is most effective when delivered as soon as possible after an action or incident. This means providing feedback at the hospital before the patient care report is completed. The EMS provider is intensely aware of the events surrounding patient care and wants to know how well he or she has performed. The EMS officer needs to be ready to provide specific information to recognize or help improve that EMS provider's performance. Discipline is a moral, mental, and physical state in which all ranks respond to the will of the leader. The EMS officer builds discipline by training to meet performance standards, using rewards and punishments judiciously, instilling confidence in and building trust among team leaders, and creating a knowledgeable collective will. Discipline is divided into positive and negative. Positive discipline is based on encouraging and reinforcing appropriate behavior and desirable performance. Negative discipline is based on punishing inappropriate behavior or unacceptable performance. Positive discipline is directed toward motivating individuals and groups to meet or exceed expectations. The EMS officer provides positive discipline by identifying weaknesses, setting goals and objectives to improve performance, and providing the capability to meet those targets. Positive discipline is reinforced by recognizing improved performance and rewarding excellent performance. If a provider's performance needs improvement in a particular area, the EMS officer should coach the provider, giving guidance and extra opportunities to correct the problem. The officer sets the stage for positive discipline by setting clear expectations and by walking the talk. EMS officers are working supervisors. That is, they supervise while directly participating in EMS activities and performing non-emergency duties. The EMS officer should demonstrate a personal commitment to the agency's goals, objectives, programs, rules, and regulations. Empowerment is one of the most effective strategies within the realm of positive discipline. The EMS officer aids personnel in learning more about how the EMS agency and the local government work together. The EMS officer should help providers locate tools to help them achieve success. An officer who identifies an area where improvement is needed can often empower a provider to correct the problems on their own. An oral reprimand, warning, or admonishment is the first level of negative discipline. considered informal by many agencies, usually stays with the officer and does not become a part of official personnel records. In most situations, these actions will suffice to correct the behavior. As a part of this process, the officer must determine whether the provider is unable to meet the required performance, which will require additional focused training, or, if unwilling to perform, will start the fact-finding process. Some EMS agencies require the EMS officer to use a standard form when issuing an oral reprimand, warning, or admonishment. The form ensures that the EMS officer covers all of the requirements of an informal reprimand. The form also allows the EMS provider to understand that this is a disciplinary issue and to have an opportunity to respond. Agency policies usually require all of the official personnel records and work history to be in a secured central repository. The file typically includes the hiring packet, such as application, candidate physical agility tests, test scores, and medical exams, their tax withholding, I-9 status, and insurance forms. Personnel actions such as promotions, increase or decrease in pay, evaluation reports, grievances, and formal discipline documents are also included. Supervision of EMS personnel requires that the EMS officer conduct regular evaluations to provide feedback on the job performance, their on-duty behavior, and problem resolution. Provider evaluation should be an ongoing process throughout the year. The annual performance evaluation is a formal written documentation of the provider's performance during the year. The EMS officer must determine each new provider's skills, knowledge, aptitude, strengths, and weaknesses, and then set specific appropriate expectations for every new provider. Regular feedback from the EMS officer should keep providers aware of how they're doing, particularly after incidents or activities that presented a special challenge. The EMS officer builds discipline by training to meet performance standards, using rewards and punishments judiciously, instilling confidence in and building trust among team members, and creating a knowledgeable collective will for the team. Positive discipline is directed toward motivating individuals and groups to meet or exceed expectations. Agency policies usually require all of the official records of personnel work history to be in a secured central repository.